Welcome to the SPINDI Community Connections and Dementia podcast. These podcasts are to share the journey of Chinese Wellbeing to raise awareness about dementia in the Chinese community in Liverpool. My name is Dr. Clare Hammerton. I'm the Coproduction and People and Carers Involvement Lead for the SPINDI Dementia Network. I'm here with Burbidge from Chinese Wellbeing and Ruth Eley from Together in Dementia Everyday Tide.
Hello, my name's Burbidge and I'm the Chief Operating Officer of Chinese Wellbeing. I also chair the diversity subgroup for the Liverpool Dementia Action Alliance, and I'm the strategic co-production partner for the SPINDI network.
Hello, I'm Ruth Eley. I wear several hats at once, and for purposes of this, I am the chair of Together in Dementia Everyday, Tide for short. We're a Liverpool-based charity with a UK-wide reach that works with current and former carers and people with dementia. I'm also the vice chair of the Liverpool Dementia Action Alliance. So in that context, Di and I have known each other for a very long time, and I'm looking forward to this chat. Tide is also a strategic co-production partner for SPINDI.
This is podcast 1, recorded in April 2025, titled Inspiring Passion and Community Champions. So I suppose it would be good for us to talk about why we're here having this conversation. And it's because, Di, you've got such a wealth of knowledge and experience around bringing dementia into the Chinese community, bringing knowledge into the Chinese community. And what we want to do is just talk about that and bring out the different points on your journey, whether it's people, whether it's actions. What is it that has meant that there has been so much impact in the Chinese community, and what is the impact that's left to achieve as well?
Oh, big question there, Claire. What's left to achieve? I suppose I'll go back to the beginning, but from a personal point of view, I do have experience of my grandmother who had Alzheimer's disease and my mum who had vascular dementia following a stroke. And I guess that really those two experiences have given me something that has led me down the route that I've gone. But I have to say, and I've thought carefully about this, one of the factors leading up to my passion about getting dementia care sort of into the community, the Chinese community particularly, was a Dementia Information Day held at Hope University back in 2012.
It was a week, actually, Di.
Oh, it was a week, Ruth.
It was a week because I organised it.
Oh gosh, Ruth, I wasn't sure because I was very new at the time, okay?
Yeah.
And myself and the chief executive of Chinese Wellbeing at the time, Colin Ling, we went along to the conference. And I actually took part in the simulation of what it's like to be living with dementia, where the goggles go on, your hearing is impaired, there's loud music, you're in a darkened room, you're asked to put gloves on, to dress yourself with a pair of pajamas, to pour a glass of water, and all the time you have people shouting at you. I'm slightly claustrophobic. I was quite shaken by the experience, but it really gave me a sense of, my gosh, there needs to be more done to help people living with dementia in whatever community. And that particular moment in time sticks with me, and it has done. And I know that there's been an invitation recently to repeat that because somebody is on tour with that. I won't do it again, but I would recommend anybody who wants to really, who's involved and is passionate about dementia care, actually does it for the experience. There was a session on the lack of good quality care in our Black, Asian, minority communities. And I was just inspired by it, totally inspired, and followed it up with one of the community development workers at the time, Diab Imbola. That guided everything from there. That was the moment in time. And at that moment, I was acting as a consultant for Chinese Wellbeing. But then they went on to advertise for a service development manager. And I went along. And I remember in my interview being asked, where do you want to take Chinese Wellbeing with service development? I said, do you know, we really need to improve dementia support in the Chinese community because there is a real lack of it. There's a lack of awareness, there's social stigma, and there are people out there who are desperate for support. We have to find them. We were involved in social care. We've been an organisation that has been supporting the older community members for many, many years. And that just seemed to be the natural progression for us as an organisation and a charity.
Well, that is so interesting, Di. I feel quite humbled that that week inspired you to do what you've done. Yes, I was asked to project manage and to organise it. I don't know if you remember Pam from Liverpool Personal Services. She asked me to do it, so I project managed and organised that week. It was quite something, really. But what it did was it led to the key strategic partners in the city agreeing to have 2012 as the Year of Action on Dementia as part of their decade of health and wellbeing. And from that grew the Liverpool Dementia Action Alliance.
Wow.
So there we are.
Because I remember very clearly the Year of Action on Dementia.
Yeah.
That's where I met you, Ruth. I didn't realise at the time that you were the organiser of that amazing conference week. And it was an amazing week. And I was new. I was new into the charity sector, into the third sector. I've worked in public sector, private sector, academia, and this was my first step into the world of the voluntary sector.
Because we were very clear that, you know, we've had a week and it's been great. We've had a lot of people there. Lots of people have gone away with stuff. And how do we maintain that momentum without duplicating things that are already there? On the Friday afternoon, we invited the chief execs of all the key players in the city, and most of them came actually, or sent somebody. And as a consequence of that meeting, they agreed that they would make 2012 the Year of Action on Dementia, which was more than we hoped for, really. That got everybody together around the table in the room. We did all the things you have to do when you're forming a new alliance and a new group of people working together, new partnership. We know about partnership working now, how difficult it can be. So we did all the difficult stuff during that year so that when that year was over, we were in a really good place to start the Dementia Action Alliance in Liverpool. And we're here, and we're one of the biggest and most effective, we are told, alliances in the country.
So how did that go forward? What was the next inspiring point? Was there regular connections that enabled you to collaborate?
Well, we had actually taken part in a pilot study that was funded by the NHS and professionally evaluated. And it was to assess the impact of appointing dementia champions into our diverse communities. And so Chinese Wellbeing was one of the first to appoint a dementia champion, and this was in 2012, along with the Somali community. And it was a very, very short-term funded project. And we had 4 months in which to raise awareness in the community and assess needs and try and look at ways of developing services to support those needs. And the recommendations from the report said that it was very successful because the champions chosen were from within the community. So they were there working in the community, they were trusted, they understood the culture, they could speak the languages, community languages, and it was a huge success. And the recommendation was that should roll it out, should appoint more dementia champions in our communities, because it really highlighted the impact that you can make working within the community. And it actually did say, the report, that Chinese Wellbeing had a bit of an advantage and a head start. We found it a lot easier to engage our community simply because we had been working in social care. We'd been providing care to people living with dementia for many years. And therefore, we had a really well-established community, which we were able to engage. So when you look at the figures of the engagements, we were just excelling because we were there, embedded in the community in that way, delivering care in the home. From there onwards, Merseycare, who funded that short-term project, decided to fund 5 dementia champions on a very sort of small basis. And it was literally just to raise awareness and try and get people talking about dementia and trying to understand the social stigma and the issues and the challenges in the community. And it was 1 day a week for a limited period, but it was literally still a pilot, still looking at disseminating information in the community. So it was a small amount of funding, but we were reporting back on progress, and it was sort of being monitored by Merseycare at the time. So that was the start, really, of the journey. I have to say that Merseycare did follow up on the recommendations to a certain extent at the time. And we were looking for sort of further funding. And there was a time when the PCT was replaced with the Liverpool Clinical Commissioning Group. And this is one person who, yes, Michelle Irwin from the CCG at the time, was a dementia lead. Very, very passionate. She supported us, didn't she, Ruth,
She
throughout
did.
Year of Action on Dementia and beyond, well, beyond that. But when she got into post, we presented all the evidence of how successful it was to appoint dementia champions. And to be fair to Michelle, she said, I'm working on the strategy and I really need at least 12 months. But at the end of that 12-month period, we came together, 5 communities in one room, and all of us presented to Michelle and commissioners and the City Council just how much impact Dementia Champions had had. And Michelle said to me afterwards, Di, I absolutely get it. I saw everyone, I've met everyone, I've listened to all of the community dementia champions, and I get it. And you know what? I felt like welling up at that moment in time. Yeah, she was a fantastic advocate for equality in dementia care. It was the pre-run to getting funded by the CCG at the time, but those champions were representing the Somali community, the African and African Caribbean community, Chinese faith communities, and Arabic communities. So coming together in one big room, and every community brought 10 of their members to talk about dementia openly. And each dementia champion presented everybody, because what we were doing was we were asking the community, how should we break down social stigma? How do we communicate? What are the key messages we want to get across to our communities? I mean, it was a defining moment, that getting all those communities together. There were 50 people in the room. And of course, the one thing that brings us all together is we all shared food, different food from different cultures. And it was a most uplifting event that I think I've ever been. And yeah, it was a defining moment. And I think, the commissioners could understand. You can read reports, you can read evaluation reports, but you have to get a sense and you have to get a feel. And going into this huge workshop for a whole morning and then sitting down and sharing food with everyone from different backgrounds, different cultures, people understood. They got it. Yeah.